Hi, everybody. Welcome to our Chats with Children. I hope you're safe and well. We're actually recording this on an early Sunday morning, but luckily the sun is shining outside of my window in Surrey. And actually, I understand the sun is shining outside where my guest is this morning, who is Edward Kelly, who is the Chief Global Officer at Abiject. So, Ed, first of all, good morning. How are you?
I'm good. Thanks for having me here. I'm from sunny Edinburgh.
This morning, and I'm glad to see that your hotel room has got good Wi-Fi. It was the last time I was in Edinburgh, the Wi-Fi was terrible. So anyway, it's good to see that. Well, look, we are going to be talking about your upcoming talk, which is at the World Vaccine Congress in Europe, which actually kicks off officially tomorrow and runs from the 16th to 19th in sunny Barcelona, or hopefully it'll be in sunny Barcelona. So let's talk about that. Before we actually talk about the actual talk that you have, for people not familiar with you and also Abiject, could you give me a quick background on yourself and also what Abiject actually do?
Yeah, sure. Thanks, Rizwan, and thanks for making the time on your weekend also. And heading into a busy season of meetings, I know for you and a lot of us in the industry. I work at Abiject as the Chief Global Health Officer, and before that, was with the World Health Organization for about 16 years as the Director for Service Delivery and Safety, and before that with the U.S. government, where I directed the U.S. National Healthcare Report. So my sort of career has been built around measuring and looking and trying to improve access to safe, efficient healthcare services. So when Abiject asked me to come and the U.S. government asked me to take a job with them during the COVID outbreak, their interest was in trying to make known new ways of increasing access to some of these big global partners like WHO, like Gavi, like CEPI, like UNICEF. And so that's primarily my job, is to work on some of the global health projects and outreach to the global health partners.
Fantastic. And you mentioned Abiject. So in terms of Abiject themselves, uh, who are they? What do they do?
Abiject is an innovation company. It works in pre-filled injectables and on applying a very well-known technology, BFS. You've seen it, I know, Rizwan, and we've talked about it. It's the same technology that's used to make a lot of ocular products, eyedroppers and all. And for the first time, they've figured out a way to take something hard, a needle, and put it on something soft, which is the BFS container. And with that, increase by many-fold the possibilities of production for vaccines, and also the possibility of getting immunizations in the hands of lower skilled health workers like community health workers, and unlocking a lot of potential for increasing access to vaccines and injectable medicines.
Brilliant. Well, thank you for sharing that, Ed. Now, as I mentioned, you've actually got a talk next week at the World Vaccine Congress Europe. So what is your talk about?
The talk is on that topic, actually, around the innovation that plastics bring to the ability for packaging and delivering vaccines. At the Congress, there's a whole set of very, very interesting presentations on vaccines and the latest and greatest in sort of molecule constructions and some of the production of vaccines, but very little on vaccinations. And so one of my talks will be around looking at how BFS and the approaches that Abiject's looking at can address some of the big problems we have in global health facing us really right now in 2023 and 2024.
Well, let's look at that a bit more. So what are some of the big problems within global health that people are facing around vaccination?
Well, of course, we came out of COVID with a lot of concerns for the implications that COVID had on vaccines, everything from inequities between the global North and global South around vaccine production and access, to concerns around people's hesitancies with mRNA vaccines and others. But one of the biggest impacts has been that COVID left us with the biggest gap we've ever had in the history of vaccination for children. We have 50 million children who have gotten 0 doses of vaccines because of the interruptions that COVID faced, both on vaccine supply, but also on just regular vaccination schedules and vaccination deliveries. So unless we figure out a way in very shortly to get vaccinations into those kids' arms, they're about to age out of the normal cohort where we would catch them in the healthcare system. So that's probably our biggest concern. And then you have the questions around trying to address those inequities or on the supply chain that new ways of delivering vaccines have to be invested in.
Right. Now, without going through the whole presentation, but how can Abhiject then and their solution help in terms of helping with that problem?
Well, the short answer is that the new, in terms of addressing the zero dose children, addressing supply chain constraints, and also, of course, doing it in a way that's environmentally sustainable and gaining for the future, you have to find new technologies for doing it. And so BFS allows, because it's a technology built around high volume, safe, sterile production, it is will allow us to move to by 100-fold in terms of vaccine packaging and delivery, first of all. And then because it's single dose, pre-filled, and safe, we are looking at ways and are already testing in the field ways that community health workers, who in most countries around the world are not allowed to give vaccinations because it's not so simple to titrate a syringe and deliver it into a child's arm, can use those pre-filled syringes to deliver vaccinations in the last mile. And honestly, community health workers are the only ones that are going to reliably and repeatedly bridge that last mile in places where we're not reaching.
Fantastic. Well, obviously, viewers, if you want to know more about that, that's a very, very quick snapshot, then make sure you check out Ed's presentation. So, Ed, I didn't ask you, the most obvious question was, when is the presentation? What day is it and what time is it?
Yeah, it's 11 o'clock on Thursday. They save the best for last. It's the last day of the conference, but we're also going to be there with our partners from HIPRA, who's working with us on a project on COVID vaccines, and they have several interesting presentations on BeamerVax, their COVID vaccine. We'll be there with Fareva, our packaging partner that's in southern France as well. So their presentations are sprinkled throughout.
Right, you froze for a second, Ed. I think I must have frozen your end as well for a second. So you just repeat that bit about Favera that you just mentioned.
Yep. And we'll also be there with Fareva, who's one of our packaging partners based in southern France. So there's some presentations throughout the other days that you should also be checking out.
Right, fantastic. Well, I'm guessing the Wi-Fi is about to go either at my end or your end. So we'll shorten this a little bit now just to make sure we don't lose you. So final questions. If people want to learn more, obviously, then come and catch you at the event. And how will they be able to meet you at the event, by the way?
Well, obviously, I'd be really pleased to see people after my talk. We'll be there all of the days, and you can look us up on the app for the event as well. I'm taking a lot of meetings with folks. I personally will also be at the World Vaccine Congress West Coast. That'll be at the end of November. But just the following week, the Abhiject team will be there and back in Barcelona at CPHI with a booth with our colleagues from Fareva. And so the team would be happy to see folks there. And also, of course, we have a very active LinkedIn page and would be happy to connect that way.
Well, Ed, you've covered everything. Thank you very much for doing that. So there you go, viewers. If you are attending the World Vaccine Congress Europe next week in Barcelona, lucky you, the sun hopefully will be shining, will be warmer than it is here, then make sure you check out Ed's presentation on the Thursday. But also, as he said, quite rightly, connect with him on the app. It's a great app and it's very easy to connect with people and set up meetings. And if you can't do that, obviously, meet Ed and the team at the World Vaccine Congress in San Diego, which is, I think, in November. I might be wrong, but
That's right.
then, and I'll put the link for that so you can see that as well. I'm sure Terrapin will be very happy for me to promote that as well. And also, if you can't do that, then obviously you can visit them at CPHI next week, or the week after next, I should say. And also check out the LinkedIn page and the website. So Ed, it's lovely to see you. Thank you for taking time out on a Sunday morning to talk to me. Enjoy the rest of your Sunday in Edinburgh and have a safe trip to Barcelona as well.
Thanks so much, Rizwan.
And viewers, thank you for watching. I hope you found it interesting. As I said, if you're in Barcelona for World Vaccine Congress Europe, please catch up with Ed there and don't miss his presentation. And until next time, as always, stay well and stay safe. Bye-bye. And that, Ed, is a wrap. And that's like